Om Sri Sai Ram. I offer my gratitudinal reverential salutations at the divine lotus feet of Swami and loving Sai Rams to all my fellow professionals here. Right from 1970s, with the grace of Bhagavan, All India Sri Sathya Sai Seva Organization has initiated vocational training program for rural youth, pan-India. It has continued thereon, and in 1990s, the then All India President, late Sri V. Srinivasan Garu, has redesigned the entire program in the name of Rural Vocational Training Centers. From then on till 2018 or 2021, Sri Ratnakar Garu has given us the best idea, has to rename this program as skill development programs. So right from 2021 onwards, Pan India, we have started this skill development programs. Among the skill development program, right from threading a needle in tailoring and fashion designing for Mahilas up to paramedical courses, we have conducted these training programs in semi-engineering courses, software courses, then plumbing, carpentry, electrician courses like that. And for Mahilas, fashion designing, tailoring, beautician course, Mehendi, etc. We have conducted a number of programs for rural youth who are mostly 10th class dropouts, 10th class pass or fail, or +2 dropouts. Some of the paramedical training courses which you have envisaged so far is Home Health Aid 1-month course. It is also called as Healthcare Assistant course, 1 or 2 months, General Duty Assistant 1 month, then First Aid CPR training, Dental Technician, and nowadays we have redesigned the course in such a way that the trainee will address both the patient from pediatric to geriatric care. So we have extended this training program for around 5 months of training and 1 month of internship program. This is the first program we have started in 2018 in a district called Khammam in Telangana, Healthcare Assistant Program for 45 days. Later on, we were bogged down with the pandemic. Then we had to stop this program. Then we have envisaged this particular training program called Bedside Assistant, addressing pediatric to geriatric needs. Initially, the course was designed by one Dr. Urmila from Karnataka North. Then we have our national medical team comprising of Dr. Ramanarao Garu, our national in charge for medical and health services, Dr. Sanjay Agrawal sir, a renowned laparoscopic surgeon from North India and zonal president, and our illustrious Dr. M. Anil Kumar Garu, currently the joint director of Sri Sathya Sai Institute of High Medical Sciences, Puttaparthi. They have reviewed the entire content and added a lot of value to that and saw that the training will address pediatric to geriatric needs. The eligibility is 10+2 pass, mostly female candidates. Attendance is 90% mandatory, and the qualifying mark for getting a certificate is 70%. The training faculty is mostly qualified, registered MBBS doctors, postgraduates, MD in Ayurveda, qualified nurses with 4-year degree in nursing plus MSc nursing, then MSc home science professionals, yoga trainers, etc. The regular class teachers will be mostly medical professionals plus the other fields of study also. The daily routine for a trainer will be a prayer session followed by theory and practical sessions. Initially, our Karnataka North has started this caregiver training program for 1 month for rural women with a common idea that these rural women would be able to help in their villages. Need not necessarily that they would find a job somewhere in the towns and cities. They wanted to cater to the rural needs. They have done two batches of this caregiver training programs in Karnataka North. Then we have we had this first training program for 5 months course, bedside assistant course in Himachal Pradesh. And let us see one of the trainees what she has to say. Sorry. Sorry. Yeah.
ओम साई राम। मैं अंजू कुमारी पत्नी दिलीप कुमार स्लेगदाम की निवासी हूँ। मैं श्री साई समिति धर्मशाला के प्रति अपना असीम आभार प्रकट करती हूँ, जिससे मुझे 32 साल की उम्र में BSc व्यवसाय कोर्स करने का मौका मिला, जिससे मैं 9:30 बजे से 1 बजे तक एक बुजुर्ग महिला की सेवा करके 7,000 प्रतिमाह कमा सकती हूँ और अपने पति की आर्थिक सपोर्ट करते हुए मैं घर गृहस्थी को सर में देकर संभाल सकती हूँ।
Saira. Then a couple of years back, our Sri Sathya Sai Seva organizations, Karnataka South, came up with an idea to have a MOU with the Skill Development Ministry of Government of Karnataka, called the Kaushalya Karnataka. They have tied up with this organization, Kaushalya Karnataka, and they have initiated this healthcare assistant training program. And Professor D.C. Sundaresh Garu was kind enough to inaugurate the first batch in Whitefield campus. This year, Sri Arya Ratnakar Garu was kind enough to extend a beautiful facility in Whitefield campus for skill development programs in para-nursing course. The main components of the bedside assistant course would be something like this: medical terminology, vital signs, introduction to human body, introduction to bedside assistant, healthcare safety, activities of daily living, nutrition, introduction to pediatric care, aging and community care. Taking advantage of the first course that has been delivered in Himachal Pradesh, we took the positivities from that course. Then our AP organization, Sri Sathya Sai Seva Organization Andhra Pradesh, approached AP State Skill Development Corporation for a similar MOU to start this bedside assistant course. It was started this year in March, and Sri Arja Ratnakar Garu was kind enough to inaugurate the course in Srikakulam district of Andhra Pradesh, and today the course is underway and is about to be completed. It is located in Bankers Colony, Srikakulam. Then the evaluation pattern also has been decided by our medical team. There will be a sincere internal evaluation for 200 marks, external evaluation for 300. Total marks combined would be for 500 marks. And individually, the trainer has to pass both theory and practical with 70% of marks. The minimum pass percentage is 70, up to 79.5 is B grade and above is A grade. Once the student clears this examination, then he'll be eligible for a thorough internship program for 30 working days in the following areas. We are also conducting similar programs of yoga, mind management, disaster management, and soft skill programs for our trainees. Finally, the certification, we very, very clearly mention at the last line, if you could kindly see that, the certificate is not eligible or qualification for any individual clinical practice. It's only a para-nursing course, semi-technical para-nursing course, and the trainee is not eligible for any clinical practice. Finally, I would like to draw your kind attention to a piece of statistic here. As I mentioned to you, last 4 years, we have conducted the skill development programs in various fields. We have totally conducted nearly 1,500 skill development programs pan-India, and we have trained rural and town youth to the extent of 37,181 trainees. Of these 37,000 trainees, 90% are Mahila trainees. And today, the Mahila trainee, more than 85% of them are self-employed. They are earning around 4,000 rupees for a quarter. Similarly, among gents, most of them, 60% of them have gone for the wage employment. They are also earning around 6,000 rupees as a part of their living. We dedicate this skill development mission from the All India Sri Sathya Sai Seva organizations at the Divine Lotus Feet of Bhagavan, and request all my medical professionals who are present here to kindly extend your expertise wherever you are there, in whichever state we start this program, to kindly extend your expertise and help these rural youth to accord their living through this bedside assistant course. Jai Sai Ram.